everybody. My name is Floret Koriciza, and I'm from Burundi. I'm here to present to you eHealth platform. eHealth platform connects patients and doctors so that patients can get consultation online anytime from anywhere with their preferred doctors. The idea came up when I went to one of the Burundian hospitals and saw how much patients were getting challenges with their consultation. There was a lot of people, and they had to line up, and the treatment was somehow delayed. That's when I realized that patients want to get a solution, a best solution to have the treatment at any time from anywhere. The challenges, some of the challenges are time constraints and delayed care, and there is also inconvenient scheduling appointment and discomfort. Our solution is to bring out the best and easiest way to schedule an appointment and be consulted online. How our solution works: we have three kinds of login. One for doctors, one for patients, and one for admin. Patients and doctors must have their account that they can sign up with their Gmail account or any other email ID. Once they have an account, patient can book an appointment, but the account of the doctors, they must be verified by the admin of the platform. And once the patient book an appointment, the doctor can view the appointment on his area, because there is area for doctors, area for patient, and area for the admin. And when the appointment is booked, the doctor can confirm it or cancel it. Once the appointment is confirmed, the patient gets a notification with the link of the meeting ID, so that through that link, they can get in touch with the doctor. How do we make money? We charge patient 100 per appointment booking, and we charge doctors 20% from the commission. Our target market is patients and doctors that are using smartphone or laptop. Our market size is 12.6 million, which are Burundian population, and there's 600,000 that are using internet, and as market share, we have 480,000. Attraction, we have developed our video conferencing platform, and we have 13 patients and one doctor on waiting list. Our next step, this month to July, we are improving our platform, and we are expecting to get our first clients. From August to September, we hope to break an event with 300 appointments per month. From October to December, we will be doing the marketing of our platform. We want you to support us to achieve our next miles. In general, we need 2,057.6 US dollar. We need 57.6 to host our platform for 6 months, and 500 to do marketing, and 1,500 for transport and stipend. Meet our team: Floret Koriciza, who is presenting here in front of you. I'm web and mobile application developer, and Gerald Kakunze, who is an IT officer and networking. We want you to join us to save Burundians' population.
Great. Okay, judges.
So if I'm getting this correct, yeah?
Yes.
It's like Zoom or Google Meet, but for doctors and patients.
Yes, it's like that. But we have created our own platform.
Yeah.
We don't anymore. You need to use Zoom or.
But you know the doctors can't, and certainly I'm not a health practitioner. I was saying, you know, the doctors can't, or certainly should not give prescription unless they have actually done like scientific tests on a patient. Yeah. So, oh yeah, nice, loud, super loud. Yeah, I was saying, if it's like a virtual consulting, you know, a doctor cannot give prescription unless they have conducted like an actual laboratory test on a patient. Yeah. Yeah, and how is that like effective?
Okay, after getting in touch with the patient, if it's necessary for the patient to reach out to the doctor will have to tell the patient that you may come at my office so that there is another treatment that is required that I cannot do virtually. That's
okay.
how.
I mean, it's specific. Obviously, there's no treatment that can be done virtually. Like it's like even the government. I'm not sure if doctors are allowed to do that. That's number one. Number two, I think I don't have the numbers, but in East Africa, of course, we have a very high shortage of people who have profession in like medical doctors, right? So in a normal thinking, you wouldn't really get a doctor who dedicates time for video calls and then admit someone to the hospital like, hey, how are you feeling? And then maybe they mention all they are feeling. And then they tell them, just come to the office, I'll look at you further. Instead of just going there, because certainly they already have a queue in a government hospital or in a private hospital. Because of course, like I said, there's a very huge shortage of doctors. How do you think doctors will dedicate time to interview someone virtually and then admit them to the hospital?
Okay, there are some devices that patients can use, for example, to measure the blood pressure or temperature. There are other so many devices that we can connect with a platform so that they can report those data to the doctors, and doctors can make prescription and send to the patient through our platform.
Thank you.
If we need this to be practical, we have to really simulate this to a typical online hospital. One, this will not be a question, to be just an advice. Either for this business to work, you have to make it, let's say, just an appointment system for the people who cannot go to take to the hospital physically to get an appointment, and then they go in a government hospital near them or whatever. So that's number one. Number two, like the records, because the hospitals and each treating doctor needs to do like some records of the patient. So in a typical way, if your platform now currently is only accepting like calls to talk to the doctor, so you should include also a centralized record so that they can even print and everything so that they can get the treatment, because they cannot go to a pharmacy to buy like medical if they don't medicals if they don't have prescription. So there is a way to go. It's a good idea, but practically you have to improve.
Yes. And I just wanted to add on that. Yeah, your idea is really good, but here you need to specify. It would be better if you can specify what kind of patients, because if I have headache For example, normally I know that I can rush to the roadside or, take a kind of medicine. So like, we talked about the stroke detection. So if your platform can focus on a certain kind of sickness, I don't know what kind of sicknesses are in Burundi that are killing people, but if you can focus on one thing, and then you get the doctors who are the consultants, specifically on that platform, I think that would be a good thing. Number two, how do you look at the rural populations? Because you're going to be using internet, you're going to, it's going to be an online platform. How do you ensure that somebody in the village is able to use your platform?
Well, it's time up. We have to end it there. Thank you very much. Thank you.